webinar series supported by the Fresh Partnership and the wider school health and nutrition community. I am Mohini Venkatesh from the School Health and Nutrition team at Save the Children, and I'm joined by a few of my colleagues on the team, and we're very happy to be here today with all of you to continue what for Save the Children has been a long history in sharing our experience with a community of practitioners on school health and nutrition. So without further ado, I will pass it on to Doug McCall from the International School Health and Nutrition Network to introduce our speaker for the inaugural session, Professor Masamine Jimba from the University of Tokyo. Doug, over to you.
Thank you, Mohini, and welcome to all as well. This is an exciting start to a great project. I'm not a big believer in formal introductions, except to say that I met Dr. Jimba recently in Bangkok, and I was very impressed with his work and with his presentation. And as many of us will know, if you speak up in a meeting, you get invited to do another job. And so I'm very pleased that Dr. Jimba accepted to do this presentation as our first webinar in this series, although it's been a continuing dialogue, as Mohini has said. So without further ado, Dr. Jimba or Alicia, whatever the next step is, please proceed. And I'm looking forward to hearing and then perhaps commenting on the presentation at the end of Dr. Jimba's remarks.
Yep. So go ahead, Dr. Jimba. We're ready for you.
Okay. Thank you very much. If you cannot hear me, please tell me you cannot hear. And first of all, I slightly changed the title of my presentation. The assigned title did not have "and fieldwork," but I added fieldwork because all my interest came from fieldwork in school health. So let me start. Oh. I want to briefly introduce myself. I started my career in global health in Palestine, and this is a picture I took with Arafat, and those days I had hair. And there, in 1994, I made the WHO office there, and worked in the Gaza Strip and the West Bank for 2 years, and school health one of my activities. Then later I lost my hair, but I gained a lot of confidence in global health. And one of the lessons I learned in the Gaza Strip is that sometimes high-resource countries send something harmful. For example, during my stay there, one country sent expiring medicines to the Gaza Strip, which was expiring within 3 months. And sometimes we do this kind of things. And then I went to Nepal, then started school and community health project for 5 years. And these are the outlines. I want to talk about school health practices first, and then go to policy, and then finally research in low-resource countries. So this is the picture I took in rural Nepal. It was very shocking. The infrastructure was very poor, teacher was not there, but students were somehow studying. And I wondered if school health is really possible in such situation. But later I learned that Paulo Freire learned to read under the mango tree during his preschool days. So I had a hope that even under such resource poor situations, maybe school health was possible. Then gradually I learned it was not only infrastructure or lack of teachers. They have so many problems. Lack of policy, poor environment, insufficient services, poor personal skills, and weak link with communities. And when they have so many problems, they feel at a loss where to start. So in my case, I decided to start from the toilet. And this is a toilet built by an NGO, but it was not used as a toilet. It is used as storage for firewoods. But I thought school children will need it, and also I needed it. And out of 84 target schools in Nepal, in my project, only 20% had a functioning toilet and water supply. Many schools did not have them. So we built toilet like this, and we built drinking water facilities. And one of the surprising things for sustainability is that on this red circled mark, there is a water supply system. And on this pole, they put the image of Hindu god. By doing this, they took it as a holy place. And by doing this, they could maintain this holy water supply system very well. So in this way, the local wisdom was well used, even under such low resource settings, and it lasted for a long period of time. Also, children, child club members, worked very well to educate other children. And they worked for the warming programs too. And also they conducted other health activities such as first aid training. Then the problem is sustainability. By using local wisdom, toilet and water supply system was sustained. But these other school health activities were not well sustained after the project was ended. Then besides this toilet or water supply system, what else was sustained? It was school health unit in the Ministry of Health. These days there were no school health unit in the Ministry of Health. So there was no responsible person, no responsible body there. So we talked a lot with the Ministry of Health and were successful to make school health unit under the Department of Child Health. And once a policy is institutionalized like this, it tends to last long. So school health unit is still there, and I'm very glad to see that later. So,
Hey, Dr. Jimba, excuse me for a minute.
Yes.
This is Alicia. I'm just wondering, can you just let us know when you want me to change the slides? I'm just having a hard time figuring out which slide you're on. Are we on the correct one right now?
Yeah. I push this next mark. Yeah.
Okay, so if you push it, nobody else can see it. So I'm pushing them through on my end, and it's changing for everyone else.
So should I say next?
Yeah. So when you're done with one side, just say next slide, and I will push it through.
Okay.
Thank you.
Yeah. Next, please. Can you see this outlines? This is a school health policy in low-resource countries. The subtitle is a big umbrella for practices, but it should be a simple, not over-decorated one. Next, this is a picture of one school in Laos, and I want to tell something about the reality of school health. And from my school health experiences in many countries, I have an impression that school health means health activities done at schools by donor agencies. Many poor resource countries have money to give salary for teachers, but they do not have money to conduct projects in these schools. So donor agencies usually pay money for running school health programs in these countries. Next. So this is a picture to show how poor the school classroom in one Laos school. Next. It shows the problem of donor-driven school health. So you can see the students taking the warming tablet twice in 2 weeks. And two donor agencies do not cooperate together, but these students blindly take medicines. And this is a safe medicine, but sometimes they take more dangerous medicines. So this is something we have to be very careful. And it happens, next please. It happens because lack of school health policy in resource-poor countries. There are many disease-related policies: malaria control policy, HIV policy, or dengue fever policies. And school is one of the places to implement such policies. But they sometimes do not have school health policies. These days, many countries have, but when I was working in Laos, there was no school health policy. So I thought it might be very important to make a big umbrella of school health under which these disease control programs are implemented. Next, please. Then Ministry of Health and Education made the first school health policy and the guideline. And it functioned as a school health umbrella, and which makes school health umbrella very visible. So by this, many donor agencies are supposed to follow the school health policy of this country. Next. And they revised the policy 5 years later. So it's good. But the problem is implementation. So the policy is important to bring about changes. Give money. And other provinces which did not receive such project did not change or did not implement the policy well. And from general aspect, there are many criticisms against policy making, particularly in resource poor countries. They said it's a paper exercise. And policies are made, but nothing happens. And policymakers are not always implementers. For example, health promoting schools concept or policy. These things, policies are often made by WHO or UNESCO, and the local officers are involved, but not strongly. And these external officers make perfect-looking policy, but it's not always implementation friendly. It looks perfect from the eyes of donor agencies, but not really from the eyes of local implementers. I show one contrast, policy which is easy to implement and the policies which are difficult to implement. Easy one, immunization, tuberculosis, malaria. These are vertical type programs, and the action is comparatively simple. So it is easy to implement. But if you look at universal health coverage or school health, this is very broad, and there are many things to do. So when they have a long menu of actions, they tend to be at a loss what to do. So about the policy implementation, Whitman introduced this framework, and they showed the factors influencing implementation of school health policy, and there are many things are here, vision and concept and others. So let's go to the next. And by using this framework, we conducted one study in Lao PDR. And we've already published this in Health Promotion International. And if you go to Google, you can download full text. And by conducting this research, we got the following conclusion. For sustainable and nationwide implementation of the National School Health Program in Lao PDR, the following three factors need to be embedded in the educational system. Number one, extensive planning with a clear long-term vision at national level. Second, human resource management, including well-organized training at each administrative level. Actually, as I mentioned before, we did a training only in 2 provinces, and in the remaining provinces we expected Lao government will do the same by using their own fund, but they couldn't. And implementation was limited only in 2 provinces. The last one, a monitoring cycle to understand the real situation at school level. And according to the SHN members report, research reviews identified in 2015, on page 4 it is written that this kind of research is only recently turning to focus. And there are not so many research about implementation, capacity building, working in different contexts, working within the core mandate. So I think this kind of research should be more conducted in resource-poor countries. And maybe implementation research is the area we should strengthen. Next, please. So this is the last part, school health research in LRCs. Next, please. This is a very old paper I published. I made a literature search about school health research in low-income countries in East Asia and the Pacific. 10 countries are listed in here. In those days, these countries were all belong to low-income countries. And the key message is that in 4 decades, or in the last 40 years, only 63 articles were published. in these countries. And parasite was the most common topic. So we often said evidence-based policy or implementation, but evidence was so limited in these countries. And this is the details of the area of research, but the message is similar. Next, please. And after this, we also, at the Bangkok conference last year, I tried to look at the situation of systematic reviews for all health programs in these countries. So this is beyond school health. Then I found, and this exclude high-income countries, research from high-income countries. So this is all about low and middle-income countries. There are also big number of papers which targeted low and middle-income countries, 216. But actually, if you look at the contents, many papers from middle-income countries come from upper middle-income countries, not lower. So if you look at low-income countries, only 8. And if you look at low and lower middle-income countries, only 7 articles. So systematic reviews are also not well done in resource poor countries. Next. And this is the one highlight I like from Doug's report. He sent us a report, education, health promotion, safety, social, economic, sustainable development in low-resource countries. And I think his point is very interesting. Game Stewart, he mentioned strengths-based perspectives, the importance of strengths-based perspectives. I quote, strengths perspective and strengths-based approaches offer service providers ways of working that focus on strengths, abilities, and potential rather than problems, deficits, and pathologies. And this approach is very important for practices, but maybe for research too. Next, please. And he said there are 7 important principles, like having many strengths and have the capacity to continue to learn, grow, and change. And the focus of intervention is on the strengths. And communities and social environments are seen as being full of resources. As I showed in the beginning slides, I found a lot of resources or wisdom in poor Nepalese communities. Then it emphasizes the importance of self-determination or empowerment. And I think these principles are very, very important. And these days I found these strengths for researchers in several low-resource countries. So 20 years ago, there were not so many PhD holders or master degree holders. But now, in Nepal, in Lao PDR, and other African countries, there are many good researchers. So I think these principles can be used for research in these countries. And then I pick up this from Doug's report, a knowledge development and exchange agenda for low-resource countries. The problem is all the contents are wonderful, but it's a mega list of menu. Strengths, weakness, linkages, opportunities, challenges, there are many things. So we need to know how to select the best food. Maybe we need a guideline to select the best food. And also, we may need a way to strengthen LRC, HLC high resource country network. Or maybe we need to know how to strengthen LRC network. And by strengthening these networks, maybe we can produce more research, and better we can implement practices in a much better way. So the last slide. So my last message is, why don't we strengthen networking like this for school health research and actions? Thank you very much. This is the end.
Alicia, I think I'll jump in if I can. It's Doug. Just to first of all thank Dr. Jimba for an excellent overview, and as people are preparing their questions or comments, I'll perhaps jump in with first of all a compliment to his additional word at the beginning of the title of the slide. I really think the addition of the word field work is very important, because knowledge is not only generated and accumulated in research journals, it's there in local communities, and it's already present in the communities that we work in, be they low resource or high resource countries or communities. They already have a lot of things they know about, and they can do things effectively. So it's really important to recognize that. And maybe as an aspect of that, there's also another source of knowledge is good data. When I was collecting that list of systematic reviews in all countries, I was first of all pleasantly surprised to see the list of systematic reviews in low resource countries, but also as we did that work, we noted that good data, reliable data, showing things such as school enrollments going up when certain interventions are done in schools, that's wisdom, that's knowledge. And so we can take good advantage of that and to bring that into our conversation. If the people in a community or a country note and can prove and can show that more students are attending school and participating in school and staying in school as a result of a variety of interventions, or even particular interventions, then that's something that needs to be brought into the conversation about what we know and so on. So I think that's a very important aspect of this, and thank you, Dr. Jimba, for bringing it up. Alicia, do you are we opening up for comments and questions? How do you want to proceed?
Yeah, Doug, we can open it up for questions. If you wouldn't mind facilitating, if any participants have any questions, feel free to write them in the comments box, and we can take a look. Doug, you can see the comments box, correct?
Yes.
Okay, so let's take a look. Anyone who has any questions, feel free to write them down, and Doug, I'll leave it to you to facilitate and direct the questions to either you or Professor Jimba or anyone else.
Okay, so as Alicia has indicated, if your screen looks like mine, you might need to move the screen over a bit to see the comments. Just so if you just type the message into the message box at the very bottom of your screen and then press enter, I guess that's how it gets forwarded to everybody. And so please make the comments there. Or Alicia, I'm not sure. Can people turn on their mics and also say things as well, just generally, just jump right in. I'll be happy to negotiate that.
Absolutely. Yeah.
And so Mahini great. And Mahini has already commented. First of all, a number of thank yous for the presentation, and then Mahini has also commented about the need for strengthening the network for school health and nutrition programs through this community of practice, and so that's one of our goals. And just maybe to do a bit of noting that We've been very pleased to have the cooperation of Save the Children, Partnership for Child Development, the UNESCO HIV Health Clearinghouse, a number of other partners within FRESH who are really taking a hand in this dialogue. So looking forward to that. And so these series of webinars will be part of a longer conversation. Although, as Dr. Jimba has pointed out, there are many, many topics that we could be talking about. We'll just try to work through the ones that we can as best we can. A question from Eric. Do you have any research papers specific for school eye health? Dr. Jimba, do you want to take a stab at answering that?
Actually, I do not have it, but some potential PhD students are interested in it, but it may take time to get published.
Okay, so that's maybe one of the items we need to look at on our agenda. And Eric, if you could follow that through the discussions we're going to have in this series of webinars, that will be great. We'll make sure that we come back to that particular topic as best we can. Maria has also made a comment about establishing a separate department within the auspices of the Ministry of Health, a separate department for school health, and she's asked, how was that done? How did you get that established, and how long has it continued to function, and how did you get it done through advocacy or collaboration?
Mm-hmm. Yeah, I implemented a JICA project which was supported by the Japanese government, and so for this I had a very contact with Ministry of Health officers, and I frequently negotiated with them, and I pushed them to have special unit for school health, but I forgot how many years, but at least 1 year it took me, and maybe 2 years, and to make something new in the Ministry of Health is really challenging. And one of the interesting thing was that one day Norwegian government came to Nepal to implement the school health programs. But after searching the structure of the Ministry of Health and Education, they found that there was no responsible unit of school health in either ministries, in either ministry. So they thought, if there's no specialized unit, maybe their school health program will not be implemented well. So they left the country without starting school health programs. And this might push Ministry of Health to create such school health unit. So sometimes this kind of donor agencies introduction of school health may accelerate to institutionalize school health unit in a country where there's no such unit.
Okay, and Mohini has added a comment as well about Nepal, how it's launched its school health policy in December 2013, and there were a number of people from Save the Children who were involved in that, and as we all know, Nepal's schools were so hard hit by the recent terrible catastrophe there. So again, thank you for that. I see there are people typing questions and comments, so I'm going to wait for that to come up, and maybe I'll jump in with one and respond to Dr. Jimba's comment about implementation and capacity research, and noting that more research needs to be done in those areas to kind of do what we're just talking about, the building of a team within a ministry of ministries of education, ministries of health is one of those capacities. So wondering how that can be done, and the strategies, the steps, the kinds of structures, the kinds of partnerships, the kind of job assignments, all those kinds of things need to be studied as part of that conversation. Comment from Caroline about Stuart's idea of strength-based perspectives, noting that most of the publications are still totally problem-based, and asking if there are journals that could be more open to a strength-based article. Dr. Jimba, could you take a stab at that, and perhaps then I'll add as well.
Yeah. I'm trying to find the Stuart's idea of strengths-based perspective. Yeah. I'm not sure about journals that are most open to strengths-based articles. If you get good scientific evidence, I think any journals can take it. But there are some journals which accept field action type studies, like WHO Bulletin, American Journal of Public Health, or PLOS Medicine. You don't need to be very scientific. No need to take IMRAD style. Just scientific description of your successful fieldwork may be published in these articles. I repeat, WHO Bulletin, American Journal of Public Health, and PLOS Medicine. But they are all high-impact journals, so we may need some more easy journals for publication of these field action reports.
And maybe I could jump in as well to answer that question. We look at over 300 journals as part of our information service for our members, and briefly, there isn't one specifically that I can recollect that's focused on strength-based, but there are several that are not focused on problems. There are a few that deal with place or settings or communities or context. There's several that deal with systems-based approaches, which starts to get back into capacity. And so there are a number of newer journals that are starting to use language other than disease and problem-based. So there's more and more opportunities for the strength-based conversation. And so perhaps as a follow-up to this session, I will post those. I'm assuming that both on the Partnership for Child Development website and we've been maintaining a list too. We'll be able to add items for people to refer to. And so I'll go and answer that question as best I can from the list of 300 journals that we look at. We don't read them all, but we do look at the school titles, extract the school titles out of those journals. Second question from Audrey. Are there any good examples of intersectorial collaboration between ministries of health and ministries of education in school health? And so, Dr. Jimba, from your experience?
Yes, a Lao example is very good. In 2005, when they made a school health policy, Ministry of Health and Education worked very closely. And the central level collaboration went very well, and also province or district level. So, and I think I wrote description in my paper, and I can send it to you. And also this is written in the Whitman's book, School Health, case studies in global school health promotion from research to practice. One Lao officer from the Ministry of Education write one chapter about it. So you may know the details of the collaboration. And usually when they collaborate, what I have observed is that specific school health program or successful school health program start in the Ministry of Health. And then when it comes to scaling up, Ministry of Education work much better. So starting from the Ministry of Health and then move to Ministry of Education, this might be a common pathway to scale up school health activities.
Thank you, Dr. Jimba. And just to comment and correlate that, that's certainly, as many of you will know, we've been having a discussion led by the education sector about how to integrate programs more effectively within school systems. And that's one of the bits of advice that we're offering, is that the leadership needs to be either assigned, transferred, or facilitated so that the education sector, education ministries and agencies are really taking ownership and leading the discussion in many ways. And so the wisdom that Dr. Jimba has identified is being reflected in some of the discussions at that table as well. Further questions or comments before we start to move towards a close for the session? Dr. Jimba has identified, I think, some important areas: implementation and capacity, integration of systems, certainly developing the strength-based approach. I think those are some very broad themes. I see that more people are and also looking for another session on school eye health. Eric, thank you for reminding me. We'll make sure that we can come back to that topic. That's great. And I'm waiting. I'm watching people type, and so I'll just repost this address. It may not. I guess in this web meeting platform, the comments go up off the screen on my computer anyway. So if you go to schoolsforall.org with hyphens in between, there's a number of discussion groups, and we've started one there. And also, if you go down the left-hand navigation page, you'll see also what we call bibliographies and toolboxes. And I think you'll find that there's a really extensive list of items that we're starting to build through this conversation. From a number, but in particular, the UNESCO and sending you back to the UNESCO website to follow out the resource. So well, that's good. Mohini has asked a question about financing for school health and nutrition programs in the collaboration, and so I think that's important. And then also Mohini, I think, is asking Laura, can you talk about the recent experience in Ethiopia? And Laura, go ahead. Okay, and so Laura's noting that that's in the next webinar on the 15th of July. And so, but Laura, maybe give a bit of a teaser, if you could, just maybe a highlight from that session that you might want to ask people to think about. That would be good.
Yeah, hi everybody, no problem. So yeah, essentially PCD, Partnership for Child Development, have been working in collaboration with multiple partners in Ethiopia, and I think that's what Mohini is referring to in terms of the financing. Yeah, well, I guess there is an MOU between the MOE and the MOH. They've recently also launched their school health and nutrition strategy, looking at various different relatively simple interventions. And some of these are definitely being led by the Ministry of Health, and some of them are more based within the Ministry of Education. I'd say deworming is more of a Ministry of Health, and it's being financed largely by health and partners. Ministry of Education is really more spearheading, I'd say, the vision screening and the school feeding. And really what's making it work is the presence of the technical working group, and having people engaged in that and partners engaged in that. And finally, I think a couple of weeks ago, the Ministry of Education held a kind of a partners forum, an NGO forum, where they, as part of their recently launched education sector development program, they invited all the NGOs to this one-day workshop to say, this is what our agenda is, and can we get support in driving that forward. And hopefully the outcome of that is that you would avoid things such as the multiple deworming in the same school type of incidents. So you're really capitalizing on resources, but more importantly, it's also being driven by the government. So I don't know if that's enough of the experience of Ethiopia. I'm sure I could go on and on, but yeah, the presentation I'll be giving on integrating interventions will certainly be drawing largely on an experience and an example we've got in Ethiopia.
Great, thank you, Laura. Further comments or questions as we again move towards finishing up the session? Any further? If you're interested in helping define the agenda, I'll refer people to this page, which is what we've been using. That's where the agenda topics is, the one that Dr. Jimba referred to. There are many, many topics, and we're not going to be able to cover all of them in this webinar series for sure, but if you want to get something posted on that list, and as we proceed through this conversation, which we hope will occur over several months, and we'll deal with things as best we can with the resources we have as we move forward, please do take time to look at that and add items that would be very helpful. So again, Schools for Health with hyphens in between the words, and look down for the discussion groups or calls for contributors, and you'll see the one on low resource countries. And there's on that page, if you get to it, there's also a kind of a little summary, a little what we call glossary terms, where we've tried to look at defining work in this context, again, drawing from a number of excellent sources, many of whom you will see and recognize. No, it says actually, no, the title is schoolsforall.org. It's more a take on the Education for All from UNESCO. So it's schoolsforall.org with hyphens in between. And so that, and Mohini is going to share the link to the webinar series. Yes, and so Mohini is also, again, referred to the webinar series page that we're maintaining, and that's at schoolsandhealth.org. And if you follow through to School Health and Nutrition webinar series, you should be able to find it. And so Carolyn has thanked Mohini for that as well. So further comments or questions for Dr. Jimba? I think a great introduction to this series of topics, and coming back to that about field work and knowledge. Research, published research is very important, peer-reviewed research is very important, but I think we also need to recognize that that knowledge is generated by both good data, reliable surveys and administrative data, and most importantly, the wisdom in the field in terms of the people working in that context. It needs to be respected, promoted, and used. And a number of themes that come out that we'll try to make sure that we're addressing: implementation capacity, and other topics like that, strength-based approaches, and then also topics that were raised specifically, integration of ministries, very important topic to look at, which we will be looking at an example next session, and then also eye health as being another particular topic that people are interested in. So thank you again, everybody, and Alicia, back to you and to Mohini for any final comments. And Dr. Jimba, maybe you could also close up with a comment or as we finish up. So Dr. Jimba, and then Alicia and Mohini.
Yeah, thank you very much for your participation. And last time when I joined this kind of web-based conversation, I made a total failure, but looks like it went well, and I hope to continue it with you. Thank you very much.
Alicia, Mohini, any final words?
Mohini, on over to you.
Thank you, Alicia. Can you hear me?
Yes.
Am I audible?
Yes.
Great. There's a bit of background noise here. I hope that doesn't filter through. I'm very happy that this first session has talked a lot about, how can we strengthen the evidence for school health in low resource contexts? What are some of the practices we should be looking at? Professor Jimba shared with us his experience that speaks a lot, as well as the papers and the journals that summarize some of the good practices that one must follow. And in part, we're trying through these webinar series to also contribute to the evidence-based, the research through these presentations and through the bibliography of documents, both gray literature as well as published articles that Doug shared while earlier in his talk. So please do visit the Schools for All site to look at the bibliography. It's developing, and there's still a lot more that will be added to it, thanks to the work from the ISHN and fresh partners. The UNESCO IIEP is contributing towards the webinar series by providing
Mahini, you seem to have cut out. I don't know if others are hearing him, but I'm hearing you, but I'm not.
Hello, everyone. I think that Mohini's connection may have dropped.
Okay.
I'm not sure that she's going to get back on in time for us to finish.
Yeah, that's fine. So I think she made her point, and just to reiterate that. So folks, watch for the next session, which is the 15th of July. It'll be sent out in a couple of different email lists, as well as take note of the two addresses, schoolsandhealth.org, which is the website operated by the Partnership for Child Development. One of the leaders in this project is keeping a list of webinars, and so please use that page. And also for reference materials and the agenda and so on, schoolsforall.org is where we're hoping to have that longer conversation. So thank you, everyone, for your participation. And again, Dr. Jimba, thank you for staying up. I know it's early for me, but it's late for you.
Yeah, thank you. Good night.
So thank you very much for staying up and participating and leading this conversation.
Thank you very much. Good night.
Okay. Thank you, folks. That's all for now.